Hello, everyone. A very good morning to one and all. And I welcome you to today's webinar, episode 2 of virtual reality in medical and health sector. As we have discussed in our previous webinar, we will be having an in-depth learning experience of each topic, wherever virtual reality and augmented reality is aiding in medical and health sector. So today, we are going to have a detailed webinar on enhancing surgical precision and efficiency through virtual reality and augmented reality. My name is Mohammad Imran and I'll be your host for today's session. So we have an exciting and informative webinar lined up for you. So how and why virtual reality and augmented reality in surgery? So before we get into that, let's have a small briefing on surgery. So surgery has come a long way in the past few decades, with technological advancements enabling minimally invasive procedures, improved imaging, and better surgical tools. However, even with these advancements, surgery remains a highly complex and challenging process that requires a high level of skill, precision, and attention to the details. So, virtual reality and augmented reality technologies have the potential to revolutionize the way we approach surgery. How? This can be achieved as VR and AR will be helping by providing the surgeons with enhanced visualization and improving spatial awareness during the procedures. By using these technologies, surgeons can visualize the anatomical structures in 3D and explore the surgical sites from different angles. And this will be helping them to practice procedures in a simulated environment. So, in today's session, we will explore the benefits of virtual and augmented reality in surgical practice and discuss how these technologies can be used to enhance precision and efficiency in surgical process. So, anything which starts with a process will be having a learning module. So, if you are getting into a surgeon field of expertise, the training and education plays a very important role. So the following are the topics which we will be discussing in detail today, which are associated with surgery and where AR and VR will be aiding. So the first and the foremost comes the training and the education. So how does the VR and AR will be aiding surgical applications with precision and accuracy in training? So training and education are very crucial components of any surgical program. However, the traditional methods of surgical training, such as observing surgeries, the live surgeries, or practicing on cadavers and working with live patients, all these traditional methods have limitations. These methods can be expensive, time consuming, and there is a significant risk for the patient's life. But here, VR and AR, the virtual reality and augmented reality technology, can provide realistic simulation of surgical procedures. And this will be allowing the surgeons to practice and improve the skills in a safe and controlled environment, which can be evaluated later and without risking harm to the real life patients. So this can reduce the learning curve for new surgeons and improve the overall quality of the care. So virtual reality can provide a more efficient and cost effective and also a safer alternative for surgical trainings and education. It can create a realistic simulation of surgical procedures, which will be allowing the surgeons to practice and improve their skills through repetitive process. For example, if a surgical process has to be attended in a traditional method, there are limitations. Either they will be have to rely on the video recordings, which are not precise, and live demo classes are not possible each and every time. And whenever these sessions are taken care of, there is a critical risk for the patient's life. So VR will be aiding by removing all these limitations and providing a high definition practice procedures. So with VR, surgeons can simulate a range of surgical scenarios and different processes, from routine surgeries to complex procedures. They can practice their techniques, fine-tune their skills, and experiment with different approaches and tools, all without the need of expensive equipment or putting real patients at risk. So So VR can provide instant feedback to surgeons, allowing them to identify areas where they need to improvement and the adjustment to be done in their technical accordingly. uh, this can significantly reduce the learning difficulties for the new surgeons and improve the overall quality of medical procedures. So the another advantage of VR in surgical training and education is that it can be easily standardized. This means the surgeons can receive the same level of training and education regardless of their location or access to the resources. This can help improve the quality of care, reduce disparities in surgical outcomes. So the use of VR in surgical training and education definitely has the potential to improve surgical skills, reduce the risk of complications, and improve the patient's outcome. Now that we have an understanding of how VR and AR will be aiding in surgical trainings and medical education, let's move on to the next level. So, what is the main process of a surgery prior to the surgery? It is pre-operative planning. So, what is pre-operative planning? So, the surgical planning or the pre-operative planning is a procedure which requires a comprehensive understanding of patient's anatomy and any potential complications that may arise during the procedure. So, traditionally, this has been achieved through a combination of medical imaging such as CT scans and MRI and physical models of the patient's anatomy. These were the traditional methods. However, these methods have limitations in terms of accuracy, complexity, and interactivity. Whereas, on the other hand, virtual reality, just let me give you a walkthrough on this one. Whereas in virtual reality, it can provide you a more accurate and interactive tool for surgical planning by creating a 3D model of the patient's anatomy. This model can be based on medical imagining, such as the same process which we use to get the images, which are the CT scan, the MRI, and these can be manipulated and visualized in real time. Surgeons can view the model from different angles and zoom in on specific areas and manipulate the model to simulate different surgical scenarios. As you can see on the screen, how a surgeon is able to visualize the 3D model before the surgery has to be performed and understanding the anatomy and the complications if there are any, and then preparing for the surgery. So this will be helping more when compared to the traditional methods of CT scans and the MRI scans. So VR can also provide a more effective and collaborative tool for surgical plannings. So surgeons not only just they can view the 3D models, but they can also share the same 3D model in a collaborative way with other members of the surgical team, such as anesthesiologist or radiologist. So this facilitates the communication in the team and ensure that everyone is on the same page before the procedure of surgery begins. This can help to reduce the errors, improve efficiency, and improve the patient's outcome too. So in short, we can say one thing: the use of VR in surgical planning has the potential to improve accuracy, efficiency, and the safety of surgical procedure. It will be helping surgeons identify potential complications, optimize their approach, and improve collaborations among the surgical team. Now that we are discussing about improving accuracy, how does VR AR aid in improvisation? So let's discuss on few main terms where VR and AR improvises and helps the surgical precision. So the first thing is improvised visualization. As you can see on the screen, the visual spatial awareness of a surgeon has been expanded in a traditional method, which was just MRI scans and the CT scans. So during surgical procedures, surgeons need to have a clear and accurate view of surgical field so that they can perform their tasks effectively and safely. However, the traditional methods of visualization, let's have some examples such as surgical loops, microscopes, and endoscopes. These all have the limitations in terms of resolution, field of view, and depth perception. But on the other hand, virtual reality, it can provide a more detailed and immersive view of surgical field by using a high resolution display and the advanced visualization techniques. So VR can simulate a 3D model of the patient's anatomy, as you can see on the screen right now, and project it on a head-mounted display worn by the surgeon, allowing them to see the surgical field in high definition from different angles. So by providing a more detailed and immersive view of surgical field, VR can help surgeons see structures and tissues that may be difficult to visualize with traditional methods. Let's have an example. It can help identify small or hidden blood vessels, tumors, or nerves that may have been missed while we are trying to identify the situation using the traditional methods. In addition to this, VR can provide a better depth perception and a better hand-eye coordination by simulating the distance and the positioning of surgical equipment in the real time. This will be helping the surgeons perform delicate maneuvers more accurately and reduce the risk of complications. So not just that, but VR can also provide additional information to the surgeons during the procedure practice, such as real-time feedback on the temperature and the pressure of the tissues, which can help the surgeons to make more informed decisions during the process. So overall, we can say one more thing is that the use of VR in surgical visualizations definitely has the potential to improve the accuracy, reduce the risk of complications, and enhance the overall quality of the care. It can provide surgeons with a more and detailed and immersive view of the surgical field. So here we are having a small presentation of how a surgical training can be performed in collaboration. So we will be discussing this as enhanced collaboration. So virtual reality can provide a fantastic platform for surgeons to collaborate with colleagues in real time, regardless of the location. We have to underline this point, regardless of location, because this can facilitate the sharing of expertise, reduce the need of travel, and improve the patient's outcome. Because we have to understand sometimes the critical situation, the time plays a very crucial role. So reducing the need for the travel and collaborating at the same time when an emergency occurs will be aiding to save the patient's life. So through VR, surgeons can connect with colleagues around the world, share 3D models of the patient's anatomy, and discuss surgical process and the techniques. So this can provide a more efficient and collaborative approach to surgical consultation and improve the quality of the care. So let's have an example. VR can be used to conduct remote surgical consultations where a surgeon can guide a less experienced surgeon through a procedure in a real time. This can help improve the less experienced surgeons and reduce the risk of complications. So VR can also be used to train surgical teams, allowing them to practice and improve their skills together in a safe and controlled environment. This can improve communication and teamwork, which will be definitely reducing the errors and improving the patient's outcome. So finally, we can say one thing is that VR can be used to simulate complex surgical procedures, allowing surgeries just 1 second, please. Yeah. So allowing this surgeons to practice and experiment with different approaches and techniques. So what will be this beneficial of? This can help to improve the overall quality and can reduce the risk of complications. So what are the other benefits of VR and AR in medical surgery? So it's not only just like reduce the risk and also reduce the cost of that medical process, which also includes the rehabilitation. So rehabilitation is a process where muscles have to be trained, the brain have to be trained, the hand-eye coordination have to be trained to the patient so that they can get back into their normal lives. As you can see in our next video, VR can be utilized to provide a different training scenarios in a gamified method, helping in different terms such as accuracy, traumatology, neurology, orthopedics, and these practices can be done utilizing the virtual reality technology. So VR can help reduce the need of invasive procedures and shorten the hospital stays, which can help healthcare costs for the patients and also providers, while also reducing the risk of complications. With VR, physicians can use a non-invasive method to diagnose and train certain medical conditions. Let's have an example. For example, VR can be used to train and provide virtual colonoscopies, which can be less invasive and more comfortable when compared to the traditional colonoscopies. So, VR can be used to diagnose and treat certain psychedelic disorders without the need of invasive procedures. So, VR and AR can be used to reduce the length of hospital stays for patients who are undergoing surgery by providing realistic simulations of surgical procedures. So, it will be helping them to prepare for the surgery and reduce the anxiety, which can reduce the need for post-operative and shorten hospital stay. So post-operative is something that where a patient needs to understand the complexity of the surgery, and this might lead the patient to have an anxiety attack. So this has to be taken care of, which can be done using VR and AR, which will be eventually reducing the stay in hospitals. So furthermore, VR can be used to simulate the rehabilitation exercises like the one we are seeing on the screen at the moment for the patients with physical disabilities, and this will be allowing them to practice and improve their mobility without the need of the traditional invasive procedures. So, by reducing the need of these invasive procedures and shortening the hospital stays, VR can help lower healthcare costs for patients and the providers. In addition to this, it can reduce the risk of complications associated with invasive processes, such as infections and bleedings, which can also be helping lowering the healthcare cost and improving the patient's outcome. So, in the end, we can say one thing is that the use of VR in healthcare has the potential to provide a less invasive and more cost-effective approach to the diagnosis. And I would like to share one of the medical experience here, where a patient has to go through a brain surgery, a tumor surgery. So the surgery was not a complicated one, but the patient was a little scared about the experience. So the case study goes in such a way where the patient had to go through the surgery, but was anxious and was not prepared for the surgery. So what the doctors did was they took the data from the CT scan and the MRI scans, and they created a 3D model of the patient's brain, and let the patient experience the 3D model while the doctors were explaining the complications in a collaborative environment. This made the patient understand the complexity of the situation and how the process will be helping her to reduce the pain that she's been suffering from. So in the end, what happens was like the patient was aware of what surgical process has to be done, and what her mental condition should be at that particular time. So this helped to reduce the anxiety, and the surgical procedure went very well. The overall experience of the patient was in such a way that she was able to recover, and she didn't have that anxiety effect during the surgical process. At the same time, the surgeons gave feedback stating that this process helps to take care of the patients in a much better way, and conducting the surgeries in more efficient way. So this is how the virtual reality and augmented reality is playing a very crucial role in medical industries. So we can assume that in coming years we'll be seeing the more interactivity of the virtual reality and augmented reality in medical sector. So I believe that the virtual and augmented reality technologies do have the potential to revolutionize the way we approach surgical processes. By providing surgeons with enhanced visualizations, improving their spatial awarenesses, and these technologies, which we can use, and the surgeons can improve their precision and efficiency, leading to better outcomes of the patients. And I would like to know if there are any questions regarding this that I'll be more than happy to answer. So before we can move into next. Just give me 1 second, please. Yes, please. Tell what we have discussed now regarding the surgical approach in health sector, where the virtual reality and augmented reality plays a crucial role. I would like to know if there are any questions that need to be answered, or if you have any queries regarding that. So please let me know. Well, it seems there are no questions at the moment. So thank you everyone for attending the webinar for the episode 2 of virtual reality in medical and health sector. We will be coming soon again with episode 3, and again we will be discussing one more crucial topic regarding the health sector, where augmented reality and virtual reality plays a very crucial role in development, and what is the scope in the future for the virtual reality and augmented reality in the future. So for now, thank you for your time, and I'll be expecting to see you in our upcoming webinars. Thank you for the time, and have a great day. Signing off, Mohammed Imran, Project Manager, Developing Creative Solutions.